Hospitals in North Texas are warning about a spike in RSV cases in children. Children's Health reports treating 382 cases last week system-wide. That's a new record. The hospital system reported fewer than 300 the week before. And officials say RSV cases have shot up 200% since the start of October. Cook Children says they tested well over 800 patients last week, and 240 came back positive for RSV. Joining us now to talk more about the signs and treatment for RSV is Dr. Preeti Sharma, a pediatric pulmonologist at Children's Health and associate professor at UT Southwestern. Dr. Sharma, thank you so much for being here.
Sure, thank you for having me.
We want to start with the basics here. What is RSV?
Yeah. So RSV is respiratory syncytial virus, and it's a respiratory virus that causes lower airway inflammation and lots of mucus production, which leads to coughing and respiratory distress.
So for parents of babies and small children, what is the difference between RSV and your typical cold?
So often they present in the same way. Some of the early symptoms may be very similar, but babies, particularly young babies or babies who have underlying medical problems, may have more cough, which leads to difficulty feeding, respiratory distress, dehydration. And so it really, looking at the progression of symptoms is important.
Why do you think right now we're seeing this surge that we're seeing? What's happening?
So this is kind of the season where we see it. And for the last couple of years with COVID mitigation strategies, we've seen fewer cases. And when we did start seeing an increase in cases, it was at a different time than we were accustomed to. And so now I think we're in the right season for RSV, and we're seeing kind of the usual progression of lots of people get it to begin with, and that also contributes to the spread.
And so that was kind of my next question. You beat me to it, how it's spread from people to people.
So unfortunately, fairly easy to spread, and it's really contact with infected droplets. So, kids, they sneeze on each other, coughing, and just exposure to those respiratory droplets that contain virus.
And I know a lot of times when we talk about RSV, we are talking about children and babies. Mm-hmm. Is it something that kids can transmit to their parents?
Absolutely. Yeah, and for most healthy younger adults, it's a cold, and it's maybe a severe cold, and the symptoms may last a little longer than average, but usually they do okay. The adult high-risk population is those who are older, immunocompromised, or have other underlying lung conditions.
And so thinking about those symptoms, thinking about how it's spread, and just the surge that we're seeing now, if someone's child does have this condition, if they have this condition, what are their treatment options? How can they get this to go away?
Yeah. So primarily it's supportive care. So if there's fever, taking care of that with medications to control fever, making sure that babies and children stay well hydrated, and if there are concerns about how they're breathing, reaching out to their healthcare provider.
Awesome. Dr. Sharma, thank you so much for being here, keeping us smarter, helping us stay healthier. We so appreciate it.